10 warning signs of stroke 1 month before. Are you aware that there are warning signs of a stroke that you can identify even 1 month in advance? Identifying these signs early and preventing a stroke is far more effective than waiting until it's too late. In this video, we'll reveal the top 10 warning signs of a stroke 1 month before that you need to know about. Hello, everyone. I am happy to welcome you to our channel where we discuss health and wellness issues. Here is a very important topic we are going to discuss: early stroke signs. Have you ever heard that 1 month before a stroke happens, you can identify warning signs of one? It is possible to prevent strokes by recognizing these signs early on. Now let's talk about these warning signs. Number 1. High blood pressure. High blood pressure poses a significant risk when it comes to strokes, and it can also cause harm to the blood vessels within the brain. Recognizing high blood pressure is crucial, and it often reveals itself through some common symptoms. These may include persistent headaches, feelings of dizziness, and occasional nosebleeds. These signs should not be ignored, as they can be indicative of elevated blood pressure, which, if left unaddressed, can contribute to serious health complications. Monitoring your blood pressure and seeking medical advice if you notice these symptoms can play a pivotal role in maintaining your overall well-being and reducing the risk of stroke and related complications. Number 2. Memory problems. When it comes to memory issues, they can actually serve as a sort of alarm bell for a potential stroke. You see, these memory problems often signal that something's not quite right with the blood flow to your brain. Now, these memory hiccups can come in various forms. Things like forgetfulness, confusion, or struggling to stay focused. It's essential to be aware of these signs, as they could be an early indicator of a stroke, which is when the brain isn't getting the blood it needs to function properly. So if you or someone you know is experiencing memory problems, it's a good idea to pay attention and seek medical advice when needed. Number 3. Difficulty speaking. Having trouble speaking can be a sign that a stroke might be on the horizon. It's like a warning signal that something's not quite right with the part of your brain responsible for language. Things like stuttering, slurring your words, or struggling to find the right words to say are some common signs that something might be amiss. Number 4. Fatigue. Fatigue is a symptom that often doesn't get the attention it deserves as a potential indicator of an approaching stroke. It's important to recognize that there are various factors that can contribute to fatigue, and these can sometimes serve as warning signs. Common causes of fatigue include not getting enough sleep, dealing with high levels of stress, and having an unhealthy diet. While these factors alone may not always signal an imminent stroke, it's crucial to be aware that persistent and unexplained fatigue should not be ignored, and seeking medical advice is advisable to rule out any underlying health issues, including the possibility of stroke. Number 5. Sudden headaches. Sudden and really bad headaches can sometimes be a warning sign of an upcoming stroke, especially if they come with other strange feelings or problems. But remember, headaches can also happen because of tension, migraines, or sinus issues. So, if you have a sudden severe headache, it's essential to pay attention and consider talking to a doctor if other strange stuff that's happening too. Number 6. Numbness or weakness in limbs. When you experience numbness or weakness in your face, arms, or legs, it's essential to recognize that it can potentially signal a stroke, which involves damage to the brain. However, there are also other common reasons for these sensations that are not related to a stroke. Pinched nerves, often due to pressure or compression on the nerves, can lead to numbness or weakness. Arthritis, a condition involving joint inflammation, can sometimes affect nerve function and result in similar symptoms. Additionally, carpal tunnel syndrome, which involves pressure on the median nerve in the wrist, can cause numbness and weakness in the hand and fingers. While these conditions can cause discomfort, it's crucial to be aware of the signs of a stroke. Number 7. Vision problems. Having trouble with your vision can be a sign that something might be wrong, like a stroke. This happens because it can mean there's a problem with how blood flows to your brain. Some common vision issues to watch out for include blurry vision, seeing double or losing vision in one or both eyes. Number 8. Loss of balance. If you start feeling unsteady on your feet, it could be a warning sign that a stroke might be on the way. This happens because it suggests that something might be wrong with the part of your brain that helps you stay balanced. Some usual reasons for feeling wobbly include issues with your inner ear, not so strong muscles, or even certain medications you might be taking. Number 9. Chest pain. Chest pain can be a signal that something's not right with your heart, like a stroke. It happens when there's a problem with the blood flow to your heart. There are a few things that can cause chest pain, like a heart attack, angina, which is when your heart doesn't get enough blood and oxygen, and acid reflux, when stomach acid flows back into your throat. So if you feel chest pain, it's essential to pay attention because it could mean something serious. Number 10. Nausea and vomiting. Feeling nauseous and throwing up can sometimes signal that a stroke might be on the way because they show that something isn't quite right with the blood flow to your brain. But it's important to know that there are other reasons for feeling sick and vomiting too, like eating bad food, catching a virus, or even getting motion sickness. Conclusion: there isn't any scientific proof right now that shows clear warning signs months before a stroke happens. However, there are certain things called risk factors that can make a stroke more likely. These risk factors include having high blood pressure, smoking, diabetes, high cholesterol, and heart disease. To lower your chances of having a stroke, it's a good idea to keep these risk factors in check and live a healthy life. Also, if you or someone you know suddenly experiences serious symptoms like trouble speaking, sudden numbness or weakness in the face, arms, or legs, or a really bad headache, it's crucial to get medical help right away because these could be signs of a stroke. Thanks for watching. If you enjoyed this video, like, share, subscribe, and click on the bell icon so you never miss a video. And be sure to check out our other videos.